This is the audio lecture for exercise considerations and vital signs. Previously, we had discussed how to take various vital signs. Those can be applicable in a clinic-based or exercise-based setting. Some of the vital signs that we had talked about included temperature, pulse, blood pressure, respiratory rate, and pulse ox. Some of those vital signs can be altered based on medical conditions. And those conditions can lead to patients or clients taking different medications. There are some specific medication considerations that we need to take into account when we're looking at exercising. So, one of the biggest things is patients that are on blood thinners need to avoid high impact activities because they can have an adverse reaction. Another thing to keep in mind is that patients that are on beta blockers and alpha blockers can have an altered heart rate. That means their pulse can be too high or too low. Beta blockers and alpha blockers are a type of medication that can be used for patients with heart disease. So because of that, we might need to alter our intensity of exercises for patients on beta or alpha blockers. Another classification of medications that can impact one's ability to exercise are ACE inhibitors. ACE inhibitors are used for conditions such as heart disease, hypertension, which is high blood pressure, or diabetes. Some of the side effects or risks of ACE inhibitors is that it can cause weakness, headaches, and dizziness. If we have patients that are experiencing those symptoms because they're on ACE inhibitors, we might need to modify their exercise prescription or plan for the day. Another thing to consider is we need to postpone exercise following a hypoglycemic episode that has occurred in the last 24 hours. So hypoglycemia or a hypoglycemic episode is a low blood sugar episode. So these are some of the things that we need to keep in mind. This is a list of some commonly administered drugs in older adults. These include things like blood thinners, beta blockers, alpha blockers, ACE inhibitors, and statins. While these are common in older adults, that doesn't mean younger adults might not also be taking these things. So we need to make sure we have some sort of health history prior to doing exercise with a client or a patient. This chart here also tells us some of the indications. So the indication is why they're on that medication, and then some of the side effects, specifically things that could impact exercise or their ability to exercise. So why do we make you make sure to know how to take and interpret vital signs? One of the things is that when we're having a patient participate in exercise, we want to know their target heart rates. If we don't know how to assess heart rate, how can we ever ensure that we're getting in those target heart rates? This chart gives us a good indication of target heart rates for middle-aged to older adults. And so this is a really good breakdown about, based on our exercise goals, where we might want to be. While there's no cookie-cutter approach to exercise, we do have some age-specific considerations that we want to keep in mind. One of the things are comorbidities. Comorbidities are when you have simultaneous presence of two or more morbid conditions or diseases in the same person. So this could be something like having hypertension and type 2 diabetes. Comorbidities happen more often in older adults, but again, that doesn't mean younger aged people can't also have comorbidities. Comorbidities can also affect a person's function and ability, especially when it comes to exercise. Another thing to keep in mind, as we age, our peripheral blood flow decreases. So, peripheral is farther away from the core. So, blood flow to things like our hands and our feet decrease with age. So, that's something to keep in mind. We want to make sure that we're not having any like numbness or tingling or anything like that, that we have full sensation, because if we have decreased blood flow to, let's say, our feet, we could be more prone to tripping. Older adults also have less air is exchanged with each breath as we age. So their lung capacity is going to be different, okay? There's less exchange between their oxygen and their carbon dioxide as they breathe, as they age. So the intensity of something that we might do for a 30-year-old is not necessarily equivalent to an 80-year-old, just because of that change in air exchange. Another consideration when it comes to age is VO2 max decreases by about 10% per decade aged, right? So somebody who's 80 has 10% lower VO2 max than somebody that's 70, and so on. So if we look at a 50-year-old compared to an 80-year-old, that's a 30% decrease for the 80-year-old compared to the 50-year-old, which can be significant. So we need to keep that in mind when we're thinking about breaks, reps, intensity, things like that. The last thing is that as we age, our ability to adapt to exercise and the heat reduces. This is really important. So, older adults can't tolerate exercising in hot conditions nearly as well as younger individuals. So, think about your environment that you're having them participate in exercise in, and you might need to modify your workouts or your exercise prescription based on the temperature of the environment that you're in. Exercise can have an impact on some of our vital signs, specifically blood pressure. So, one of the benefits of exercise is that it can help lower our overall blood pressure. This isn't necessarily just while we're participating in exercise, but consistently participating in exercise can help lower our blood pressure overall. Inversely, while we're exercising, blood pressure tends to increase. So we need to be conscious of that, especially with some of our at-risk population. You might need to do a blood pressure check before and during exercise with adults that have issues or tend to be higher with their blood pressure to begin with. Blood pressure increasing too quickly or too high can lead to increased strain on the heart and blood vessels, and this can be really catastrophic. It can lead to things like arterial ruptures, heart attacks, and strokes. So it's something that we need to consistently monitor with our patients, especially those that have predisposed risks to high blood pressure to begin with. Because if they already have high blood pressure, overall exercise is a positive thing. But if we exercise too intensely and raise their blood pressure too quickly during that session, we can have significant issues on their overall health. Some other considerations with blood pressure, especially with exercise, is that if somebody has high blood pressure during exercise and they also have delayed blood pressure recovery, it's associated with increased risks. So what that means is if their blood pressure spikes too high during exercise, but also it doesn't decrease quickly enough after exercise, that can be associated with things like hypertension, cardiovascular disease, and death. So it's something that we really need to keep an eye on. The ACSM and the AHA recommend terminating exercise in the following conditions. 1, if somebody's blood pressure reaches 250 over 115, and or there's a 10 millimeter of mercury drop in their systolic pressure while exercising, okay? These things are associated with cardiac issues. Before they return to exercise, they should be cleared by a medical professional. So we need to have a baseline blood pressure measurement for these individuals in order to make these appropriate determinations. Within your role, you might be working with a variety of people in a variety of settings. Sometimes you might be just carrying out an exercise program, but sometimes you need to be doing exercise testing and evaluating somebody's physical abilities in order to continue with exercise. When we're talking about exercise testing, we have some absolute indications that we need to terminate or stop that testing. These include suspicion of myocardial infarction or acute myocardial infarction. So if you suspect the patients have a heart attack, absolutely need to stop. The onset of moderate to severe angina or chest pain, absolutely we need to stop. Drop in systolic blood pressure, which we had previously talked about. So if their blood pressure drops below their standing resting pressure, or there's a drop in their systolic blood pressure with increased workload accompanied by signs or symptoms. Remember, normally when we exercise, our blood pressure increases. So if it's decreasing, that's a reason we need to stop. Or if there are signs of poor perfusion, such as appearing pale, cyanosis, which is blue discoloration, or their skin is cold or clammy. These are reasons that they need to stop exercise testing and cannot resume without clearance from their medical provider. There are some additional absolute considerations that we need to take into effect on the next slide. Additional reasons for immediate termination of exercise. These include severe or unusual shortness of breath, central nervous system symptoms, which can be things like ataxia, which is failure of muscle coordination, vertigo, which could include dizziness or illusion of dizzying movements, visual or gait problems, so their pattern, the way they walk or they run, or any sort of confusion. If they seem mentally altered at all, we need to terminate exercise. Other reasons are serious arrhythmias, so abnormal heart rhythms. These can be things like second or third degree AV block, things like atrial fibrillation with fast ventricle response, any sort of cardiac issue, abnormal rhythms, feeling like their heart is racing. Those are reasons to stop. Technical inability to monitor the EKG. So those are more reasons in terms of like cardiac stress testing that we would need to stop, or the patient requests to stop. Any of those reasons, we should terminate exercise and they shouldn't return until they are cleared by their medical provider. Our previous slides were absolute indications that we need to stop exercise testing. Some of our relative indications to stop exercise testing would be things like any chest pain that's increasing, physical or verbal manifestations of shortness of breath or severe fatigue, wheezing, leg cramps, or intermittent claudication, so increased pain or pain of a grade 3 on a 4-point scale. These are all reasons we should probably stop exercise testing, but we may be able to resume at a later date based on how the patient feels. These are some additional relative indications that we might need to terminate exercise testing. These include a hypertensive response that's greater than 260 millimeters of mercury of a systolic and a diastolic greater than 115. They have pronounced ECG changes from baseline, or they have exercise-induced bundle branch block that cannot be distinguished from ventricular tachycardia, or less serious arrhythmias. So all of these reasons would be indicated to stop exercise testing. Again, most of these things were going to be hooked up to monitoring and done in a lab setting, but that's not necessarily correct. So we need to be able to monitor our patients to the best of our abilities when we're putting them through exercise testing.